nerves connect each and every part of the body from head to toe. So, doctor, what are the common diseases that involve nerve damage?
Usually, while talking about nerve damage, common conditions are one is diabetes. Due to the complication of diabetes, lot of nerve damage is happening. Major nerves, minor nerves, small nerves, everything. Because due to the nerve damage, end organs are also affected in diabetic case. Other type of nerve damage is nerve root damage, nerve due to compressive myelopathies, due to the compression of intervertebral disc compression or any other mass compression. Space occupying lesions will compress the root of the nerves, and gradually nerve innervations to particular muscles or any organ will be under some stress, and that will eventually affect the function of the muscle or function of the organ. That type of complaints are very, very common. This will turn to the, in term, it will end up in a, what you called, our karmendriya, jnanendriya, balakshaya, means sensory capacity of the sense organs will be reduced, like motor capacity, functioning capacity of motor organs will be reduced. That will end up in a problems.
Okay. So, doctor, can you add something on this?
Actually, considering that nerve-related issues, there are two major classes we can think of. One is physical discontinuation of nerves. That can be due to some sort of accidents or some sort of cut or in some sort of injuries. On the other hand, there is another class of diseases which are nerve debility disorders. That is causing some sort of, it can be due to lifestyle, or it can be due to some other causes, like doctor already have mentioned, like some that manifestations of prolonged diseases, lifestyle diseases like diabetes mellitus and many other diseases including cardiac ailments also, that can cause neurological damages. There are all these nerve damages, either it can be some sort of debility or physical discontinuation of nerve. Whatever the result will be, two types of manifestations. Either it can be a sensory affliction or a motor affliction. These are the two end results of nerve debility or nerve damage.
So, what type of management can we do for these type of diseases?
Usually, to strengthen the nerves and to strengthen the organs, we usually apply Panja Shodhanas and the preparatory procedures for Panja Shodhanas like Sneha Sveda, Abhyanga Sveda, and different types of kishis, etc. can be used. If it is a very deep condition like reduced innervation, reduced nerve voltage, nerve supply, if that is too much prevalent or very, very in-depth problem is there, means we have to go for Shodhana procedure like Vamana Virejana, Snehapana, Vamana Virejana. Not exactly detoxification up to a limit. It is actually a Shodhana procedure. Once the channels are purified, definitely it will conduct more. Automatically the regenerative process, repairing process will start up. That will end up in a proper nerve functioning. And one way it can protect nerve damage also.
So, Siddha management is also similar?
Actually, in Siddha, particularly, it is more adapted to being that southern part of India. There, the occupation-related nerve damages was very much prevalent during that time. So, Varma treatments, Varma management has been given that much importance, that Varma therapy, and also that for that those two classes of nerve damages, including that permanent discontinuation, if it is happening, there were many other managements, including that Pattigattal, like that, like replacing that nerve channel and providing some bandage as a support, so that it will naturally heal. And some including some herbal poultices will be induced into that bandage, so that nerve healing will be more accelerated, like that. That is one sort of treatment. On the other hand, for nerve debility disorders, we can consider several types of diseases. From childhood onwards, there are many types of diseases, including poliomyelitis, that cerebral palsy cases. Those all come under these type of nerve debility disorders. Beyond this, there are many other nerve debilitating disorders that will manifest during adulthood also. That we can those cases will be something like involuntary muscle movements, muscular spasms, and those conditions will also be coming to our clinic that are more related to nerve debilitating disorders. Parkinsonism type, yes, that's exactly correct. Those type of debilitating disorders will also can be classified under this condition, and we can apply the same type of management technique for correcting those conditions also.
Okay. So, can you name few medications, internal medicines or external medicines used in Ayurveda?
For external therapies, to improve the functions of nerves, we usually use Dhanandaram Tailam, Mahanarana Tailam. Especially for Brahmana purpose, Mahanarana Tailam also can be used. All these Tailam can be used internally also as a drops. It will give same or some more better results. But usually in practice, it is given externally. In our practice, we use internally also these type of medicines. There are a lot of medicines, but this is very common.
So in Siddha is also?
In Siddha and in our traditional practice itself, we used to use a lot of Gayathrimeni oils, like Siddha Gayathrimeni and Veliya Gayathrimeni, Chariya Gayathrimeni. That is Chinna Gayathrimeni, like that in Tamil it will be called. Those were in practice on the southern parts of India, particularly Kerala and Kanyakumari parts. That were part of Marma therapy, Varma treatment. These oils were widely used, including some sort of Murugannas also. There are more types of Murugannas, like Kokudadi Muruganna, and a lot of things that are employed in these type of nerve debilitating disorders.
It is more applicable towards nerve damage.
Nerve damage also. Structural, like discontinuation like cases.
Okay.
Cases also. And considering that internal medicines, particularly I have to specify a particular medicine like Pune Kali Churnam. It is already proven that it is improving that dopamine conduct. So nerve conduction will be improved, and hence these nerve debilitating disorders can be controlled for a greater extent. Especially for Parkinsonism conditions. And also, there is a proven case like cerebral palsy cases. In such cases, that Udvartanam, that is in Tamil, it is called Podi Timurdal, including Bela Churnam. Only that Bela Churnam, that reverse powder application, that technique has been proven to be very much efficacious in restoring that nerve functions and motor functions that were affected in such children.
Healthy nerves equals a vibrant life. So keep your nerves at check.